Good afternoon to all. Today we will discuss about the puerperal sepsis during postmortem. So introduction of puerperal sepsis. It is a serious infection that occurs in a woman after childbirth, miscarriage or abortion. It is a leading cause of the maternal morbidity and mortality. Due to this puerperal sepsis, there is a 10% of the morbidity and mortality. Definition. It is an infection of the genital tract because it is an infection of the genital tract because infection will go through genital tract which occurs as the complication of the delivery. So it is termed as the puerperal sepsis. Now the cause of the puerperal sepsis. We already discussed it in the definition. It is a genital tract infection. So it will cause from the genital area. So in genital area start from the perineum, vagina, cervix and uterus. So first we will discuss about the uterus. In uterus there is a endometritis, endomyometritis or endoparametritis. All are known as the pelvic cellulitis. Next one is the vaginal flora. This is the after that vagina. During the pregnancy, the vaginal flora contain following organism. Some organisms are dominant in active state may remain in the body, that is known as the dominant organism, that is the dodeline bacilli. It is present in our body 60 to 70%. One is the Candida albicans. It is 25%. Now the Streptococcus albus, Streptococcus vitohemolytic, Escherichia coli, Clostridium vagi. These are the organisms remain dormant or in active state into our body. When it gets the favorable environment, it will grow and multiply and lead to the infection. Next is what are the predisposing factor for puerperal sepsis. There are lot of factors which are responsible for puerperal sepsis. First one, the pathology of the vagina. So we are already discussed it in previous slides. There is a dormant organism which are responsible for growth of the microorganism. Cervicovaginal mucus. There in vagina there is a mucus membrane damage at the time of labor. Uterine surface area, uterus become larger and there is a larger surface area for infection. Wound at the placental site, there is a wound where the placenta is adherence to the uterus, that is a raw area which are responsible for infection. Blood clot, it is a good media for the growth and development of the microorganism. Second one is the antepartum factor. At the time of antenatal period, if mother is suffering from malnutrition, she is prone to have a puerperal sepsis. Anemia, if mother is anemic, so she is also prone to puerperal sepsis. Preterm labor, if labor is occurs before the time of maturity, it will also lead to the infection. Pre-rupture of the membrane, prolonged rupture of the membrane because patient may go into dry labor and it will take long time for the delivery. So it be in that time there is a chance of infection and lead to the puerperal sepsis. Next is the chronic illness. If mother is suffering from chronic illness, he is prone to lead to the puerperal sepsis. Next one is the intranatal factor. If there is intranatal factor during the labor, if repeated vaginal examination will be done by the healthcare provider, so it will lead to the puerperal sepsis. For example, there is a protocol. After first vaginal examination, second PB should be done after 6 hours because it will help to in reduction of the infection to the mother. So we will not do the repeated vaginal examination to know the progress of the labor. Prolonged rupture of the membrane. If membrane is ruptured prior to the labor, it is also one of the cause for puerperal sepsis. More prolonged labor than more. If there is a labor more than 18 hours, it is also lead to the infection. Dehydration, ketoacidosis during the labor. Traumatic operative delivery. When delivery is not occurs in normal way, then medical healthcare provider will use the forceps, instrumental delivery and vacuum extension, laceration, cesarean section. At that time there is a chance of the infection and may go to puerperal sepsis. Next one, the hemorrhage, ABH and PPH, antepartum hemorrhage and postpartum hemorrhage, because there is a blood, there is a plasma, that is the best media to growth of the microorganism. They grow there, they survive there, they multiply there and lead to the peripheral sepsis. Retained parts of the placenta, tissue or membrane. Some product remain inside the body, inside the uterus. That is one of the best media for the peripheral sepsis. Placenta previa sideline close to the vaginal wall. So if placenta is low lying, it is one of the cause of the infection because it is a big surface area, big raw surface area. It will heal after 42 hours, 42 days of the delivery. So it is a one of the cause of infection. Laceration cesarean section, at that time if wound care is not proper, aseptic technique is not used, and that is go also to lead to the infection. Next one is the growth of bacteria, where the bacteria can grow inside the body and outside. It is two type of bacteria. One is the aerobic and anaerobic. Aerobic bacteria are grow in the presence of the oxygen, or anaerobic bacteria are grow in the absence of the organism oxygen, which these organisms are remain in the body and will help to grow the grow there and cause infection. Some is the Streptococcus beta hemolytic group. It is the most common type of the microorganism. Streptococcus albus, Escherichia coli, Clostridium welchii, Calbicella, Pseudomonas and Chlamydia. These organisms are present in our body, and if they will get the favorable environment and cause the infection. Next one is the anaerobic bacteria. It is the bacteria which are grow in the absence of the oxygen. That is Streptococcus bacteria, Peptococcus bacteria, and Clostridia. These are the organisms. Mode of transmission. How these organisms are transferred to in our body. Wound infection. There is a wound. Where it is wound? Placental site. Being a raw surface area, it is a big wound. Next, genital tract, laceration, cesarean wound, and episiotomy wound. These are the wounds which are responsible for mode of infection from the localized site to the distant site. Next, our source of infection. Bacterial infection will be go two way into our body. One is the endogenous or one is the exogenous. Endogenous bacteria are aerobic bacteria, or exogenous bacteria are the anaerobic. Endogenous bacteria remain inside the body, and exogenous bacteria are coming from the outside of the body. For example, instrument, hand and hospital. The exogenous bacteria are present before the delivery in the genital tract, skin, throat and migrate to the genital tract by bloodstream or by patient by the itself. So patient if not do their proper hand washing, so at that time the microorganism can transfer to our genital tract. Streptococcus beta hemolytic group or Escherichia coli. Exogenous, when source of infection is outside the body from the hospital, articles that bacteria is Peptococcus and Clostridia. This is the bacteria which are growth transfer into our body from the outside. That is known as exogenous bacteria. Then the pathophysiology. I explain the pathophysiology of the uh, exogenous bacteria. So primary site of the infection is perineum. At that time the infection will go into the vagina, then cervix, then into the uterus. Infection localized at the distant site. So distant site is perineum. Laceration and perineum of the perineum or vagina, cervix. If there is a laceration of the perineum, vagina and cervix, that will produce the discharge that can be serological, that can be prolonged discharge, lead, and there is a chance of the increase the microorganism, so lead to the infection, and lastly patient is suffering from puerperal sepsis. Spread of infection. Where the infection will spread. If a pelvic cellulitis, how mode of transmission? By direct contact or by lymph system. If there is a peritonitis, if infection in the peritoneal cavity, where it transfer from the metritis, it is a layer of the uterus, by bloodstream के through जाता है or by LSCS. Next, salpingitis. How the infection go into the fallopian tube, may be interstitial or bloodstream or instrument used at the time of LSCS. Therefore, septic pelvic thrombophlebitis. The infection will go from the ovarian veins, uterine vein and through the inferior vena cava and lead to the thrombophlebitis. Septicemia or septic shock. It is due to the Streptococcus hemolytic group which lead to the secondary complication. So secondary complication will be there if infection is go goes to inside the body. The secondary complication be meningitis, peritonitis, endocarditis, multi-organ failure. Death occur in a 30% of the cases of 100 cases of the puerperal sepsis. Now the sign and symptom of the puerperal sepsis. It is divided into three parts. One is the local infection, one is the uterine infection, one is the spreading. First, we will discuss about the local infection. Local means if a wound is in the perineum, so there will be a temperature. The patient have a generalized malaise. Patient explain about the headache, low wound infection, local wound infection. Infection is local wound. Local wound become red and swollen. At the side of wound there is a redness, there is a swelling, there is a murmur, or there will be pus formation, or there will be a chance of the pus formation at the local site. Next one is the uterine infection. Uterine infection is divided into two parts. One is the mild and one is the severe. In mild, there is a raised temperature, raised pulse rate will be increased, offensive lochia, copious lochia, and subinvolution of the uterus. The uterus will not return to their normal stage as per the normal puerperium. Next one is the severe. In severe symptom, there is a high-grade fever, chill, rigor, tenderness, lochia secondary, subinvolution of the uterus. There is a no involution of the uterus. There is a subinvolution of the uterus. There is a tenderness. There is a odorless lochia. Increased pulse rate. There is a tenderness. Next one is the spreading infection. It is a secondary infection when infection go to the other side of the uterus, other side of the localized infection too. That is known as the pelvic peritonitis, parametritis, pelvic abscess, general peritonitis, thrombophlebitis, and septicemia. This is the infection which is occurred due to the puerperal sepsis. These all are the clinical manifestation which occur when the patient suffering from the puerperal sepsis. Next one, how we diagnose and investigate the puerperal sepsis. First, we will inspect the local site where the wound, that is the perineum, episiotomy wound, LSCS wound, even cervical tear. All these we will inspect the site for their inflammation, for their abnormal discharge, copious serological discharge. Then we will look at then the history taking. We will take the history of antenatal period, malnutrition, anemia, high risk pregnancy, all these intranatal period, repeated pelvic PB examination, use any operative delivery will be there. This is the this will told about the history taking by the mother. Next one, identification of the high risk. We will identify the high risk such as malnutrition, pre-rupture of the membrane, anemia, prolonged second stage of the liver, etc. This is the high risk which is prone to puerperal sepsis. Now, next one is the clinical examination. We will do the clinical examination such as the general examination. Patient should be checked from the head to toe. Physical examination, we will see the physical examination. We will use hand. In general examination, we will do the inspection. Physical examination, we will do the hand and eye coordination. So we will check the particular part for their for infection. Systemic examination, we will see the heart, lungs, urinary system. All systems should be checked to know the well-being of the patient. Next one is the lab investigation. We will send some sample to the lab to know the type of bacteria. So first we will send the vaginal swab in which we see the organism aerobic or anaerobic organism present in the presence of the oxygen or survive in the absence of the oxygen, or antibiotic, which antibiotic is sensitive to particular organism. Then clean catch urine examination should be done for culture sensitivity and microscopy examination. So in culture sensitivity, we know the which drug is used for kill the microorganism, and microscopic organism, which microorganism is present into the urine. Next one is the blood test. In blood test, we will see the RBC, WBC count and HB, and the low platelet count, and patient should be observed for DIC, dissimulated intracoagulation, intravascular coagulation. So this is the blood investigation which are carried out to diagnose the puerperal sepsis. Now the management. In prophylaxis management, we will start from the antenatal period. So in antenatal, we will improve the malnutrition of the patient. Patient should not be malnourished because she is prone to puerperal sepsis. HB raised level. If patient is anemic, we will provide the iron supplements. It can be oral supplements, it can be intravenous, or it can be blood transfusion. So we will treat the anemia and also treat the skin throat infection, because these infection will prone to lead puerperal sepsis after delivery. Intranatal care. At the time of delivery, we will remain some points should be remain in our minds. At the maintain surgical asepsis, we will use sterile gloves. We will use the 5 clean. So clean surface area, clean hand, clean blade, clean contact. So this is the 5 cleans which are used to maintain the surgical asepsis. Screening for the bacteriology. If patient is high risk mother, so we will send the sample to the lab for um, to know the type of bacteria is present in the blood. Identify the high risk group. So we will identify the high risk group which prone to puerperal sepsis. Reduce the chance of the wound infection. So we will use aseptic technique. We will dressing the wound with the aseptic technique that will prevent the puerperal sepsis. Now the postnatal care. When at the time of postnatal, aseptic technique should be used at least 1 week of the postpartum period. Adequate water and fluid intake should be given to the mother. Patient should be not dehydrated because she will go into the ketoacidosis. So there will be a chance of the infection. Treatment of the anemia. If patient is anemic, we will identify the patient anemia as mild, moderate and severe. According to that, we will put the patient on a treatment. If mild anemia, we will put the oral regimen. If patient is in severe anemia, then transfusion can be given, or if we have a time, then iron supplement should be given. Care of the wound. Wound can be in the vagina, cervix, uterus and abdominal, or even episiotomy wound should be done. Adequate dressing is by using of the aseptic technique. Restriction of the visitor. If patient is malnourished, if patient have a low immune system, so we will not allow the visitor to meet with the patient. Sterile sanitary pad. Even after delivery, we will advise the mother to use sterile sanitary pad because it will prevent the infection, which exogenous infection. So isolate the baby if the mother have infection. If mother is suffering from meningitis, at that time we will not give the baby to the mother because infection can transfer from mother to the baby. Next one is the medical treatment. Treatment, medicine can depend upon the culture sensitivity. So which culture sensitivity, which drug is sensitive to the particular bacteria, and the drug are given according to that. But loading dose can be given to all patient till report of the culture will come. So name of the medicine can be injection gentamicin. How it to be given? 2 mg per kg body weight, 12 hourly given. The route can be intravenous or the action is antibiotic. Then injection ampicillin, dose is 500 mg. Time is 8 hourly. Route is IV or it is also antibiotic. Injection clindamycin, it is 900 mg. It is also given 8 hourly, intravenously given. Injection cefotaxime 1 gram. Early it should be given, or it is the route is IV or it is also antibiotic. Injection metronidazole can be given 500 mg. It is also given 8 early. It is antibiotic. It is used as for kill the microorganism. Next one, the surgical management. When surgical management are necessary, when there is a perineal wound, wound drainage, stitches are open, and there will be a pus formation, LSCS wound, even perineal wound. At that time, we will use the sitz bath in several days to heal, help in healing of the wound and prevent the infection. If there is a retained product, if there is a remain placental parts and membrane remain inside the body, inside the uterus, at that time we will use the surgical management, that is the dilate and curate, and dilate and evacuate, surgical evacuation, and adequate antibiotic should be given to the patient for the prevention of puerperal infection. Next one, the if the infection is pelvic abscess, if there is a pelvic abscess, the surgical treatment is incision and drill. If there is a wound adhesiveness, the management will be by scrubbing the wound twice in a day. If laparotomy is done in case of the peritonitis. If collection of the fluid will be there, at that time we will do the laparotomy. Hysterectomy in case of the rupture of and perforation and multiple abscess, at that time surgical management is hysterectomy. Treatment of the tissue necrosis. If there is a tissue which are necrosed, at that time which type of the surgical treatment? Wound scrubbing, debridement of the wound necrosis, and effective antibiotic should be given. to the patient. Next one, the management in case of the septic shock. If patient is going into the septic shock due to that peripheral sepsis, so which type of the management should be carried out? So maintain the fluid and electrolytes. So we will give the adequate amount of the fluid, and we will give the proper electrolytes at the sodium, potassium, calcium, magnesium, etc. So patient not go into electrolytes imbalance. Monitor the CBP. So CBP monitoring is necessary. It will help to prevent the patient from cardiac problem. Respiratory support. If patient is suffering from hyperventilation or hypoventilation, at that time we will provide the respiratory support such as the ventilator, oxygen, etc. ABG analysis. We will send the sample for the ABG analysis, because if there is a gas imbalance, patient may go into respiratory acidosis and alkalosis. Circulatory support. If the volume is decreased or volume is increased, blood volume, that there is a chance of the patient may go into hemodynamically unstable. So BP will go down and BP will go very high. At that time, dopamine and dopamine can be given to the patient. It should be in our hand. Infection control by antibiotic. If patient is suffering from some infection, at that time adequate antibiotic should be given to the patient. This is about all about the peripheral sepsis. Thank you very much for